Hello everyone, my name is Madhu. I'm senior speech language pathologist. The topic of my presentation is Googling telehealth and telemedicine during COVID-19 pandemic waves in Malaysia. Moving on to the introduction, the current coronavirus pandemic is probably the most important public health challenge caused by an infectious disease since the Spanish flu pandemic. In Malaysia, the spread of COVID-19 has caused a massive change in terms of daily life and activity. Malaysia has also experienced many pandemic waves of coronavirus disease in 2019. Google Trends tool is a freely accessible public web facility that analyzes search queries in real-time online data. Moving on to the need for the study, the public online interest in health and disease can be reflected by trends in popular web search engines such as Google. Analysis of these trend data allows for real-time surveillance and ultimately serves to inform the public health and policy. The online consultation and online health information seeking behavior greatly changed during the time of the COVID-19 pandemic. To sustain the response to the pandemic, many hospitals have adopted to virtual healthcare and telemedicine. The growing field of research concerning internet-based healthcare and disease information source is now widely known as infodemiology. This massive change in daily life and activities also reflects the online behavior among Malaysians when searching the COVID information. So, understanding the emergent role of internet in the field of infodemiology is crucial concerning online health information seeking behavior. The aim of the study is to investigate the relationship between the daily reported number of COVID-19 cases and the corresponding change in Google Trends search volume of telehealth and telemedicine over 4 COVID-19 waves. The objectives of the study are to analyze the relative search volume of search terms measured over time and also to determine the strength of relationship between the daily reported number of new COVID-19 cases and the corresponding change in Google Trends data of search terms over 4 COVID-19 waves. Moving on to the method, a retrospective data of daily reported COVID-19 cases was considered. The period of interest is from the first wave to the fourth wave spanning January 2020 to December 2021. Google Trends descriptively analyzed the public interest over time of search queries. It also checks for seasonality in the time trend and the possible correlation with major world or region events reported in Google Trends. The two search terms, telehealth and telemedicine, were considered to analyze the public interest during COVID-19 using the Google Trends tool. The period of interest is 2 years spanning January 2020 to December 2021. With reference to the search input, a combination of multiple terms with a plus sign could be added to examine the compare terms. This study set the following filters for the analyzed queries worldwide: custom time range in all categories, and web searches. Search activity is reported as search volume index, which is reflective of data that are normalized over a specific period and geographic location to improve comparability between search terms. They are scaled on a range of 0 to 100, where 100 is a maximum search interest for the time and location specified. A score of 0 means there were not enough data for the term. Moving on to the results, among the two search terms, telemedicine yielded a higher search volume relative to telehealth. The term telehealth is more popular in Selangor, followed by Kuala Lumpur, Terengganu, and telemedicine is popular in Selangor, followed by Penang, Kuala Lumpur, Johor, and Kedah. Pearson correlation of public interest in search terms, telehealth, and new cases were found to be low, positive, and statistically significant during the fourth wave relative to the other waves. On the other hand, Spearman's correlation between the public interest in the search term telemedicine and the new cases were found to be low, positive, and statistically significant during the fourth wave. A moderate positive correlation was also established between the telemedicine and the new cases, and no statistical significance during the first wave. The advantages of the study are: this study witnessed how the coronavirus pandemic reshaped the public health seeking behavior in the service industry. The study also demonstrated that the public in Malaysia has a heightened sense of caution and awareness when it comes to their health during the pandemic. Additionally, people across the globe are now used to doing things virtually, from online learning to online health appointments. This will contribute to the rise of telehealth and telemedicine at the expense of traditional in-person health visits. The study highlighted the popular search terms which might help to rewrite the articles on the website or blog. The short-tail keywords can be used to market the telehealth service industry. The limitations of the study are: all this being said, we still won't know that telehealth and telemedicine service and online health seeking are actually replacing in-person appointments until the pandemic has been over for at least 1 to 2 full years. And we can go back and analyze Google search trends to see if telehealth and telemedicine search interest has fallen back or maintained its current SVI level around 20. But it certainly seems to be trending towards the latter, especially when we consider the recent data published by the CDC on the rise of telehealth services. Google Trends cannot analyze the behavior of rural or global public health with no internet access. To conclude, this study highlights how Google search behavior in Malaysia have changed over the last 2 years for the applicable search terms in relation to COVID-19 pandemic waves. It was also noted that rising positive public interest in telehealth and telemedicine in relation to the fourth COVID-19 pandemic wave compared to other waves. Therefore, it has become necessary to incorporate telehealth and telemedicine into the healthcare system to combat any possible pandemic in the future. These are my references. I thank you, the organizing committee, for giving me this opportunity.